But we will return to the clinic, and Cecilia will talk about outcomes.
Our scientific framework explains the development and maintenance of anorexia. If a young woman or a man eats too little or is too physically active, the brain system for reward and attention are activated. And dieting and a high level of physical activity are initially rewarding. And subsequently, anorexic behavior is maintained through conditioning to the stimuli that originally provided the reward. Anorexia nervosa is the prototype for all eating disorders. And we suggest that the following symptoms should be treated: the distorted eating behavior and the altered perception of satiety, the hypothermia, patients are ice cold, the hyperactivity, and the social and psychological consequences. And because bulimics share all of these symptoms, and because the psychopathology in bulimia is similar to that of anorexia nervosa, we suggest the same treatment with both groups and irrespectively of age. All children are born with a normal eating behavior, and that is eating fast in the beginning and slowing down by the end of the meal. Anorexics, bulimics, and obese individuals have all a linear eating behavior, that is, eating with the same pace throughout the meal. Dieting is the main risk factor for eating disorders, and dieting causes a linear eating behavior. So therefore, we train our patients to become normal eaters, and as a consequence, their thoughts or cognitions start to normalize. Obsessional acts and thoughts, anxiety, and depression will decrease. Mandometer is a biofeedback device that teaches you how to eat and how to perceive satiety. It's a thin scale that communicates wireless to a smartphone and measures eating speed and feelings of fullness, and allows the eater to compare her speed of eating and feelings of fullness with that of normal individuals eating a similar meal. We train the anorexics to increase their eating speed and become less satiated. And we encourage the bulimics to slow down their eating and become full quicker. And when normal eating behavior is restored, the hormonal pattern that induces hunger and satiety is reestablished, and body weight will normalize. Anton Schöring has already presented William Gull. This is a painting in my office from an article we published in Forskning och framsteg. So after each meal, the patients rest in a warm room, and the temperature can be as high as 35 degrees Celsius. An increase in temperature has an anxiety-reducing effect, and patients often fall asleep. Children are especially keen to receive a thermal treatment, as they are informed that growth hormones are released during rapid eye movement sleep, and they will grow taller. By resting in a warm room, we minimize physical activity and purging behavior after a meal. We also have a comprehensive program for social restoration and psychological support. To extinguish environmental cues that maintain behavior, we move the patient away from the risk environment to Sofiahemmet or to Novum. We have full-time employed high school teachers, arts and crafts, music therapy, and we have peer support from patients in remission and groups supporting family members. And we also have developed a reward schedule to increase self-esteem. Patients are more honest when interacting with a virtual clinician than interacting with a real clinician, and computer software is better at diagnosing psychological problems than a physician. And therefore, we have developed a diagnostic algorithm and a virtual risk assessment for suicidal ideation. When patients fulfill the following 7 criteria: normal eating behavior and satiety, that is eating 300 to 350 grams in 12 to 15 minutes, normal weight, normal labs, normal psychiatric status. Patients should be able to claim that food and body weight is not a problem any longer, back to school, professional activities and leisure activities. And of course, no binge eating or purging behavior during the last 3 months. Then a patient is free of symptoms or in remission. And we follow the patient for 5 years. And the relapse rate is low. It's below 10% over 5 years. And if a patient relapses, we offer treatment without delay. We receive 25 to 30 referrals per week. And about 20% of those are assessed for the in-ward. And 80% of those treated at the inpatient care are anorexics. And the average stay is 56 days. And then they step down in treatment to daycare or outpatient care. Currently, we have 41 beds in Stockholm and 4 outpatient clinics. Danderyd sjukhus, Sofiahemmet, Hötorget och Novum by the Karolinska University Hospital. And we have also 1 outpatient clinic in Alingsås. Currently, there are about 300 patients waiting for treatment. All have been evaluated, fulfilling the diagnostic criteria for an eating disorder. As a consequence of the distorted eating behavior, most patients have elevated psychiatric symptoms. And when the eating behavior and weight normalizes, symptoms such as obsessional acts and thoughts decrease, and also liver parameters will normalize. 0.7% of all women and men diagnosed with OCD or obsessional compulsive disorder will develop anorexia nervosa. So it's extremely rare that OCD precedes or causes anorexia nervosa. The opposite is common. Most patients will develop OCD as consequences of their disorder. This is a study of 162 patients with extreme anorexia nervosa, and that is, according to the DSM-5, a BMI of 15 kilo per square meter or lower. Those 162 patients were treated between 2012 and 2019, and the majority, of course, were treated as at the in-ward. But a small group, 22%, were treated as outpatients only. And of interest is that the majority of those patients went in remission, almost 70%, while those treated at the in-ward, 39% went in remission. In a randomized controlled trial, which is the golden standard for clinical research, we have shown a remission rate of about 75% in a treatment time of about 12 months and a relapse rate of 10% and no mortality during treatment. And these findings were replicated in a multi-center trial of 1,428 patients in 4 countries. And the remission rate, they were replicated, and 737 patients went in remission and 69 patients relapsed. Today, the relapse rate is even lower. The relapse rate today is 8.9% over 5 years, and the treatment time is less than a year. Thank you for your attention.
Thank you very much.